Good afternoon. Welcome to everyone who's watching on social media and listening on local radio. I'm joined today by the Minister for Health and Social Services and the Medical Officer for Health, Dr. Susan Turnbull. I want to start by acknowledging the pain and hardship that islanders have faced over the 7 weeks since we instructed you to stay home. The negative physical and mental effects of the lockdown have fallen disproportionately on lower income islanders, on those in smaller flats and houses without gardens, and on those who are here in Jersey without family and friends. It is falling especially on those severely vulnerable islanders who have letters from their GPs instructing them to continue to shield. People long for things to get back to normal, and I understand that. I know the measures we are taking to ease the lockdown may feel slow to you, but I promise you we are getting there. And this week we delivered, by post, advice and guidance on how we can support you more during this time. On the 29th of March, we instructed all islanders to stay home to slow the spread of coronavirus. We made the decision when we had 63 positive cases, but we're experiencing delays in receiving results back from the UK laboratory. Estimates of the virus reproductive rates even show that on this date, our R number was close to 1. And that meant that on average, one infected person was infecting one other person. Had this been allowed to continue unchecked, the R number would have grown and the virus would have spread throughout our community. If it had spread like this, with the finite health resources we had available in our island at that time, we would have potentially reached the full capacity for intensive care, and our healthcare staff would have had to make difficult clinical decisions about who got critical care and who did not. Now, we'd been preparing for COVID-19 for weeks prior to this, based on what we then knew of the virus and expert information we got from Public Health England and from elsewhere, including the World Health Organization and the Centre for Disease Control in the USA. And we increased the scale and pace of measures that would help us prepare for slowing the rate of the infection, which is referred to as flattening the curve. We'd seen what had happened in Italy, and we could see what was happening in England and France too. With a rapid increase in cases expected in Jersey, we mobilised the public, private and charity sectors into our island-wide pandemic response. We brought the GPs into direct employment, made substantial investments in PPE, built a Nightingale wing, and set up a community task force for parishes and volunteers. We instructed islanders to wash their hands frequently, to keep a physical distance of 2 metres apart from one another, to self-isolate if symptomatic, and finally ordered most of the population to stay home to flatten the curve. We needed to delay the spread of the virus and preserve our critical health services for those who would need it most, those islanders with underlying health conditions. To further protect this group, we ordered them to follow the most severe form of lockdown, known as shielding, keeping them physically away from others and away from the virus. These measures allowed us to focus on tracing those islanders who'd come into contact with the 63 positive cases and contain them at home in self-isolation. This was, and is to this day, our delay, contain and shield strategy. Through the diligent actions of islanders adhering so closely to the lockdown measures, not only did we flatten our curve, we flatlined it. 7 weeks on from the beginning of the lockdown, our new positive cases are near zero. Thanks to this strategy, we've seen only 10 positive cases over the last 2 weeks and 1,394 negative results. Our R number is closer to 0 than it is to 1, currently at around 0.4. Whilst our experts tell us that this is a good place to be, it does not mean we can go back to normal. We know more about COVID-19 today than we did back in March, and we also know that most countries in Europe are anticipating a second wave. Therefore, we will need to continue our safe exit measures such as physical distancing, border controls, and our enhanced testing and tracing to minimise any such wave. And this will form part of our new normal, and it could be around for some time. So the Minister for Health and Social Services will now explain how we're going to move into that new normal and why this is right for Jersey.
Thank you, Chief Minister. We are on a path to ultimately eliminating coronavirus in Jersey. This has been achieved through the adherence of islanders to our guidance. Our healthcare system, whilst rapidly and fully prepared to meet the demands of the virus, has not been overwhelmed. We've put in what I think are some of the most comprehensive resilience measures islanders could wish for, including the Nightingale Wing. But eliminating COVID-19 does not mean eradication. Disease eradication is when there are 0 cases worldwide. Only in that scenario would we no longer need intervention measures. I'm told only 2 infectious diseases have been declared eradicated by the World Health Organization, smallpox in 1980 and rinderpest in 2011. Whilst there are other countries who are close to declaring what is called elimination, this is not eradication, and no jurisdiction will be able to close off their borders to the rest of the world and simply wait for the vaccine to come. I'm afraid this could take years. Staying in lockdown creates and stores up other health harms that are unrelated to coronavirus. I'm receiving reports of significant harms to people's health and well-being. The mental health of many, both adults and children, has got worse as a result of lockdown. It won't improve whilst under strict lockdown, and we will see increasing numbers requiring care. We have islanders who are suffering pain, who are expecting operations or treatments which we have needed to delay. And neither must we overlook the educational and welfare harms to children of not being in normal schooling. All of these harms are recognised by other countries around the world, and this is why they are pursuing a safe exit from their lockdowns. It is not right to expect islanders to wait to face these non-COVID related healthcare issues until we have eradicated the virus. An elimination strategy may suggest to some that our overriding goal is to see 0 cases in Jersey for a period of weeks, no matter how high the cost. Given the extensive health harms that might be inflicted to achieve that goal, the government has taken the approach to ease the restrictions when we are advised by health experts. These decisions are informed on the latest evidence on COVID-19, which is changing as the world researches it more and more. And it is based on the evidence showing the benefits and harms associated with our public health measures at each level. So the way we are moving out of the pandemic is one that continues to contain the virus and shield vulnerable islanders, but which also enables civil liberties to be restored, patients to access healthcare, islanders to earn a living, and schools to reopen. It's a way that takes into account the health of our society, the well-being of islanders, the structure of our economy, and the future of our children. Underpinning our ability to do these things is our expanded test and trace program. We have increased both the swab testing to establish whether someone currently has the virus and the finger prick antibody test to establish whether someone has had the virus previously. And thousands more islanders will be tested in the coming weeks. The increase in swab testing has started with a range of essential workers who we have identified based on their risk of contracting COVID-19 through direct contact with the public. The essential workers who will be offered tests in the first instance include patient-facing health and care workers, police, fire, and prison officers. The finger prick antibody test will build on our ongoing household testing research, with the nearly 500 households continuing with their regular testing. And by expanding this program, we will make these finger prick antibody tests available to teachers, utility workers, cleaners, supermarket staff, and other workers who have remained at work through levels 4 and 3 of the lockdown. We are still recording positive cases some days, and we will see more of these as we expand our testing. But these positive cases are small in number, they are contained, and the medical experts who advise have said we are ready to open up our working lives, our social lives, our economy, our health service, and eventually our schools by doing it all as safely as possible. We may later expand our test and trace program to our ports. First of all, we will conduct trial studies to rigorously test inbound passengers on the Lifeline Blue Island flights. And only then, when we choose to safely open the airport and ports to commercial operators, to passengers at risk of bringing COVID-19 into the island. As of today, our 14-day self-isolation remains in place. I want to thank the healthcare teams delivering these tests and our tracing team who are working to keep us safe as we open our lives just a little more. Rapid detection, isolation and contact tracing will allow us to open Jersey safely, making sure we maintain a level of connectivity as we carry on living with coronavirus. If you are invited to test, please consider taking part. We are all in this together as an island community. We'll continue to monitor what other countries are doing, and we'll learn from their experiences. But that doesn't mean we will automatically copy their approach. By following our delay, contain and shield strategy, we have seriously limited the spread of this virus in Jersey, and we hope to maintain it at near zero cases. That's why we are still asking everyone to maintain strict hygiene, to keep your distance from other people, and to follow the latest guidelines as we publish them. None of us can assume that COVID-19 isn't with us, but we can move forward safely towards a way of living with very low levels of the virus. By delaying, containing and shielding, we can protect islanders and enable family life, good quality healthcare, education and employment to resume to varying degrees in the new normal. Thank you.
Thanks, Richard. So tomorrow we will be debating our strategy in the States Assembly. We've been providing States members and members of scrutiny regular briefing sessions with our medical advisors and our senior officers. As the weeks go on, we will allow for more social and economic activity based on the advice of our medical advisors and according to the guidelines prepared by those officers. So long as the advice recommends it, we will continue to move cautiously through our safe exit framework until we reach the new normal. We will continue to enhance and expand our test and trace program, continue to promote good hygiene, maintain a border control program, and enforce physical distancing. We will continue staffing our COVID-19 helpline for islanders to ask questions and report symptoms, and we will continue to support islanders with our community task force and communication campaigns. We remain vigilant and stand ready to increase the severity of the lockdown if our medical advisors recommend it. Only if there is a threat of a sudden significant increase of the virus will we force islanders back into their homes or again shut down businesses. Our strategy is working. Our curve has flatlined, our R number is well below 1, our cases are near 0, and we have islanders to thank for that. It has been and will continue to be a challenging time for our island, crushing the initial spread of the virus, creating huge economic packages to support lives and livelihoods, and communicating complex, difficult, and sometimes anxiety-raising messages have strained us all. But as much as we have learned more about coronavirus, we've also learned more about our own community. And now is not the time to go back on all the advances we've made. Now is not the time to reverse back into severe lockdown in order to pursue a strategy that would curtail our freedoms unnecessarily. And now is not the time to dash the hopes and aspirations of parents, small business owners, students, and the elderly. And slowly over the coming weeks and months, you will be able to see friends and family more, you will be able to spend more time doing the things you enjoy, and you will have more choice to buy what you want. Birthdays with grandparents, eating meals together, and allowing our children to play in groups are all part of our future with COVID-19. We will only do this when it is safe to do so, and whilst our cases remain near zero. And it also fundamentally depends on you, everyone in this island, continuing as you have been to follow the guidance, including maintaining physical distancing. So please keep looking out for one another. We are stronger as an island when we do this together in a steady and informed and controlled way. Thank you very much for listening. We're now going to be taking questions from the media. And in the format we've been following so far, we have 5 journalists off to my right on the screen up here. And obviously we have Dr. Susan Turnbull as well as Medical Officer of Health, who's also here to answer your questions. So for those listening, we have Freddie Miller from the BBC, Elodie Radule from Bailiwick, Gary Burgess from ITV, Tom Innes from JP, and Harry Booth from Channel 103. So if we can do 2 questions per journalist, but if we do 1 question at a time, and then we'll go around and once we get to the end of those, we'll see how much time we've got, and I believe we're aiming to finish at about 3 o'clock. So, Freddie from the BBC, first question.
Thank you, Chief Minister. Freddie Miller from the BBC here. My question's to Dr. Susan Turnbull, if I could. We've been talking about testing here, and you've said recently you're aiming to do 500 tests a day very soon. Can you tell us how many of those tests are going to be done completely on island and how many are going to be done off island? Because I understand a number of them have to be sent to the UK. So firstly, how many are we going to be able to do on island? Secondly, how long does it take to get these sent back from the UK? And thirdly, why can't we do more tests than we're currently doing here in Jersey? Because surely the more we can do here, the quicker we're going to get the result.
Thank you, Freddie. My first response is it's very nice to be back in the thick of it, but I really wish my colleague Dr. Ivan Muscat was here because he's the expert on the actual nitty-gritty of the testing programme. But my broad understanding is that we are reserving the on-island tests for hospital patients who are ill and in need of a rapid result, and that the majority of the expanded testing programme will be tests going off-island, but there is really a very quick turnaround for those. So the sick people will get the rapid turnaround hospital-based tests, and people who are more part of the widened proactive testing programme will get their tests within a day or 2. So that's...
And just kind of additional to that.
Do go ahead.
Sorry, just additional to that.
If it helps, Freddie. I don't have the exact breakdown, but I can give you the overview. So we increased our... Obviously, we got the on-island testing when we got the right bit of kit down that fitted into the existing pathology equipment. And I'm going to say that was around first couple of weeks of April, something along those lines. Apologies, I just swallowed some water the wrong way around, or going down the wrong way. We've also, though, engaged with 2 laboratories in the United Kingdom. So we have the one that we've been using all the way through this position, and through the good officers of external relations and some discussions that both myself and the Minister for External Relations have had with MOJ, we've increased the capacity that laboratory is taking from Jersey. We've also then been negotiating a separate contract with a separate laboratory, and I can't actually tell you whether that contract has been signed or is ready to go. It's certainly ready to go. I don't know if the ink's on the paper yet. And that is, again, adding to the capacity such that, as we've been saying over the last few days, we're expecting to get to a capacity of about 500 a day. That's about 3,500 a week. Now, that capacity is increasing. It's obviously subject to the number of tests we actually take, but the capacity is increasing. You should be seeing that in how the results are coming through. What's also been happening, which is the slight delay in just getting the contract signed, I believe, with the laboratory, is various officers, including from Digital Jersey and including from within information services within the public sector, and obviously with health officials, have been looking at the actual process by which the information is processed, by which it's communicated back to us, all those type of things. And so they've been looking at the most efficient way, which means the best and quickest way to get those tests that are going off island to the UK and how we get the results back. And so, for example, at one point in the process, and this is the lowest level of detail I'm going into, we were apparently receiving an individual report per test made. So if you had 60 pods of tests, you got 60 individual reports. So what they've been doing is they've put a bit of software in place to try and make sure that you didn't have to open 60 reports to get the data. It's down at that level of detail they've been doing, because that all increases and improves the turnaround time from what we do to the UK. The other bit is, as you increase the testing in the UK, the samples that go to the UK, is you have to be able to pack the samples correctly to make sure they don't get damaged or cross-contaminated or anything along those lines. So all of that has been going on, and sometimes it's never quite as quick as you'd like, but we are seeing quite significant progress, and that again is a positive, and again is all part of the measures that we've been doing to put the island in a really good position, including on increasing and improving the testing. I hope that gives a bit of a flavour of what we've been doing. Okay, your second question, Freddie.
Sure. Well, kind of linked to that, I suppose I'd come back and say, well, all of that you've just explained basically tells us why there are issues sometimes sending tests to the UK. Why not just do them in Jersey then? What are we waiting for in terms of getting these tests done here? I mean, we've just heard the health minister say, and I quote, "Rapid detection, isolation and contract tracing will allow us to open Jersey safely." So you understand that, and many islanders will agree with that, but why is that therefore not happening, and why are these tests still being sent away? Why are they not being done here?
I'll hand over to Richard and then see if I need to add anything else, which I'm sure I won't, but Richard.
We will be able to turn them round in 24 hours very shortly when the systems in the UK can speak to the system here in our lab, the results can flow digitally, then it's a 24-hour turnaround. That's what we need, and it's going to happen shortly.
It also means you're less exposed. So if there was an issue around, reagents or bits that you need to do some of the testing, if there was any delay in supply there, you've basically got two strands to the approach you're taking, and it's about keeping the capacity on island for the most urgent cases when they present, for example, in the hospital.
So can I just clarify, there's no ambition whatsoever to get all of these tests done in Jersey? They're always going to be sent away, are they?
Yes. Because we've determined that having some on-island facility is right, but there are other tests that it is better for us to send away to labs that are established and have the capacity to do it.
Okay, right, Elodie.
Hi, good afternoon, and thank you for taking the time to answer our questions. My first question is probably for you, Chief Minister. When will the trial studies on testing people arriving in Jersey at the harbour and the airport begin? What type of test will be used, and what will be the consequence if someone does test positive for the illness?
I'm definitely going to hand that across to Susan, who I believe they've been discussing it at STAC. I would emphasise that I believe these are all exploratory, and I think it's again worth making the point that the Minister for Health, Sir Richard, made in his statement, that as of today and for the foreseeable future, we are still operating on the 14-day quarantine for anybody coming into Jersey. But Susan.
Okay, thank you, Chief Minister. At the STAC meeting this morning, so that's the Scientific and Technological Advisory Cell, so that includes myself, my colleague Dr. Ivan Muscat, Mr. Patrick Armstrong, who you've seen on these press conferences before, and a number of other senior doctors, as well as scientists who advise STAC and make the link between STAC and the government. We discussed this morning a proposal to devise a safe alternative method to the 14-day isolation requirement that is currently the case. And what we were talking about was having a test on arrival at the airport, so optional, so people could choose to still 14-day self-isolate, but if they chose an alternative, it is possible that we could have a rapid PCR test with a result coming back within 24 hours. So they would be advised to self-isolate for that first 24 hours till they got the result. If the result came back as positive, then they would have to obviously continue to follow the guidance as an infected person. And then the other option we were discussing was the possibility of that first PCR test, because that's just a snapshot of whether the infection has developed on that day. So somebody in theory could have been exposed a day or two before and have not become positive yet. So a follow-up test at the 4-day stage for people who were PCR negative at the beginning as alternatives. And then the other, we discussed a little bit further as to the feasibility of asking people as a further alternative to have a PCR test done, for instance, in the UK, because people can, in the UK, go online and book their own tests and would come with a certificate to show that they were negative. And the added advantage of that would be that you would not be having infectious people getting on aeroplanes, for instance, because if that did happen, there would be the issue about contact tracing of people who may have been in close contact during the flight. So there's a lot of attraction in, if it's feasible for it to happen, for people to have a PCR test between possibly 2 days before travelling and then avoid the whole on arrival process. So those are the issues we were discussing. The advice is that STAC agrees that it would be reasonable and feasible to find some safe way of having movement in and out of the island without necessarily having to have the 14-day isolation, recognising that that's a barrier to commercial operators sort of resuming flights and indeed boats. So, our advice is that there is very good potential for a feasible alternative method of arriving in Jersey that's safe for the population of Jersey, but is based on at least one blood test and possibly 2.
Okay, do you want to go for your next question, Melody?
Yes, thank you very much for that. That was very precise. The other question was probably for you as well, Dr. Turnbull. The daily number of cases has been consistently below the number originally predicted. Given this fact, is it still the government's belief that we will have 800 new cases a day by July? If so, could you explain why that rationale is still there? And if not, why hasn't the model been updated?
Okay, the model was a piece of work that was undertaken when I was still very much early in recovery after my hip replacement operations. I wasn't directly involved in that, but that's what it was. It was a model. It was a model of different scenarios, different ways viral transmission could possibly be, believed to be able to happen. So at that time, there was very little knowledge at all about this brand new virus. I mean, we didn't even know what COVID was 5 months ago. It hadn't really been invented properly yet. It was just beginning to bubble up from cases clustering in China. So the modelling was a number of scenarios. It wasn't in any way a prediction of what was likely to happen. And we now know much more from what has actually happened and the different measures that have taken place at different times, and how looking at the work that was being done, a very good piece of work being done by Statistics Jersey on modelling the R number. And it's very obvious that our R number is down well below 1 because the case numbers have been declining. And we're in an exceptionally good situation at the moment, thanks to to just echo the Chief Minister's comments, the whole community's done this. It's not clever doctors or clever politicians. Everybody has pulled together and made this happen. So we really need to capitalise on the excellent situation that we're in. And just a caveat, just following on from the last question about testing, as we open up more testing to people who may have no symptoms or minimal symptoms, so talking about the groups that the Health Minister was saying will be having proactive testing offered. These are people who don't believe they're ill, because if they did have symptoms, they ought to be at home and self-isolating anyway. So it will start to pick up people whose infections wouldn't have been picked up so far under the testing facilities we've had available until now. So just a sort of a word of caution, we will start seeing more positive cases. It doesn't mean things are getting worse, it just means we're getting better. at finding even the most trivially affected people who are hardly even asymptomatic, but then taking vigorous action to make sure that all of their contacts are contacted and that they self-isolate appropriately, etc., etc. So we're really sort of upping the ante considerably. But alongside that, you will see a rise in cases. It doesn't mean things are getting worse.
And sorry, just to follow up, have you got a revised figure then for the new cases?
Well, just as a general point, if we were to ease off altogether on the precautions that have currently happened very effectively, and if the world reverted to the actual normal that it was beforehand, because from what we know so far, it's likely that only a very small proportion of the population have already been exposed to the infection. That means that probably around 97-98% of us haven't and are still susceptible. So all the possibilities of the steeply rising curve are still possible, which is why we can't just be complacent and go back to normal, because if we let that genie out of the bottle, it would be very, very hard to bring it back again.
Okay. Thanks. I'm sure Susan will correct me. That's why we've kept talking about a balance of this issue about trying to come out of where we were, but in a controlled way, and dealing with the prospect that she's just talked about, versus equally the other balance of the consequences of being in lockdown for too long. Gary.
Afternoon, all of you. Starting with some thank yous. Thank you, first of all, both ministers, for your preview of tomorrow's state speeches. That was handy to get. And Dr. Susan Turnbull, thank you for agreeing with journalists that it would be great to hear from Dr. Ivan Muscat, 46 days and counting. A question to you, Dr. Turnbull. You've had the advantage of seeing what Jersey's been doing, both from the outside and the inside in recent weeks. On Friday, we had two government ministers speaking of the virus being nearly eliminated. Today, we've heard a similar message from the podium there as well, ahead of that state's debate tomorrow. On the understanding, we are talking about the WHO definition of elimination, which is basically get rid of most of it and then play whack-a-mole with good testing, tracing and isolating. Are we not precisely in a position to pivot to an elimination strategy?
Well, I think it's semantics are a wonderful thing, and where we are at the moment is very much akin to being in an elimination situation. But in a sense, the public understanding of that word is, I believe, potentially a hostage to fortune, because if we do see a rise in cases just due to our more vigorous methods at seeking and destroying, as it were, then it could look as if the strategy had failed. And I think that my only concern about the use of the word elimination is it sets expectations possibly too high, and it may be a deterrent to taking the sensible and pragmatic easing measures that are currently being taken, which, bearing in mind we're all in this for a pretty long haul, I suspect, because there's no certainty that there'll be an effective vaccine developed. And even if there is, it's probably at least a year before it's going to be potentially available for mass vaccination. So we have to be able to behave in a way that's sustainable and durable, and that the public will keep behind, because if the public faith in sticking to really stringent measures for a very long time started to wane, then the result of that could be a big peak of infections as we head into the winter, and that is the last thing that any of us want. So I think for me, it's what's in a name, but what we've actually achieved is, Jersey's not been calling it elimination, but other places would do.
So in effect, we've had an elimination strategy all along.
Yeah, we didn't call it that, but we've look what we've achieved by keeping the public on board for delay, contain and shield.
My second question, Chief Minister, we heard from the UK government yesterday they've done that deal with AstraZeneca to buy the first 30 million of the vaccines if, and obviously a big, bold, italic, asterisk, underlined if, the Oxford trial is successful. I know in the past we've spoken about Jersey being part of any carve-outs that are done through the UK government and the NHS. Is Jersey part of that 30 million vaccines?
I think I just have to say what we said last time round. Last time I was asked the question, which is in the discussions we've had with the Ministry of Justice, they are very much taking the view that we are part of the British family, and and therefore I think the expectation would be, as things get rolled out, that we will be able to access that through the normal processes that we follow. What I couldn't guarantee today is that we would be part of the first 30 million, shall we say, bearing in mind the population of the United Kingdom. On the other hand, all the Crown dependencies are very small in numbers, and so that's the alternative solution. I don't know if Richard or Susan want to make an addition to that.
I think you said as it is, Chief Minister, yes.
So I would support that. We are already part of not part of the NHS, but our entire vaccine programme is linked to the NHS and following its guidance, and we are in regular discussion with the vaccine experts, and we know from our regular communication with Public Health England that they consider us entirely part of their responsibility. As far as the WHO is concerned, World Health Organization, the UK is as responsible for us as part of its family as it is for its UK mainland population.
But I think you have to go back to the very point you made in the first part of your question, was if underlined in capitals. So let's just see what the results of the testing of the vaccine comes out at. Can I also just make, before we go on to Tom, just one observation? Obviously the debate tomorrow is also quite important what's in the report. And in the report that accompanies the proposition, it does specifically suggest, and we'll find out more from Deputy Pershard, that islanders would be better, I'm quoting, islanders would be better served by a short period of intense lockdown. And that obviously, from my interpretation, I said this to States members earlier, we'll see what the response is. My interpretation, that would be, we would be immediately going into, well, effectively backwards from where we are. And at the moment, obviously, we can see the results in terms of what's happening on the curve. So you've got what's the justification for that? And also, what is intense lockdown? Intense lockdown, I would suggest we've never actually been in an intense lockdown at any point in this process, because we've kept things like the garden centres open. We've allowed window cleaners to continue to operate. We've allowed people to go out for 2 hours for their exercise, and then 4, and then 6 for anything. So I think we need to be quite careful when we're talking about it, bearing in mind what I've said, what Richard as Minister said, and what our Medical Officer for Health, Susan, has said. We are in a very, very good place. So that's the kind of political take on what the debate is going to be tomorrow. And actually, no, that wasn't quite my speech, but we'll see where we go. Okay,
but
Tom.
Just to clarify, the effect of your amendment is in effect to correct what Deputy Pershard got wrong in her language.
I think, yeah, that's probably the simple version. We've tried to put some flesh on it, because actually the bullet points that she mentioned in her proposition are a lot of the measures that we have already done. So it's, yes, as you say, it's just to kind of correct that. There's a lot of it might be semantics, but they are quite important semantics. And as I said, the conclusion in her report is actually very, very important in our perspective. We'll see what the view of the Assembly is tomorrow. Okay, Tom.
Good afternoon. We've got 40 minutes, surprisingly, into this press conference without the biggest topic of the day, the last 24 hours, being mentioned, which is a few hundred reckless people disobeying the lockdown and social distancing and the stipulations by gathering and drinking and littering and things like that. You talked earlier in this press conference about the harms of reversing back into lockdown that would be caused to 100,000 islanders by reversing back into the most severe levels of lockdown. In order to back up your determination not to do that, will you step up the campaign to clamp down on the small minority who are threatening that reverse being brought into reality?
So I think it'd be fair to say that we know as the lockdown measures get eased that people's behaviour does change. And so the Honorary Police and the States Police have been taking actions to try and deal with some of those areas. I've not had the specific feedback yet from the weekend as to outcomes. I have to say the ones I saw were generally quite good, but there were more people around. So the more people are out, you will see some breaches that take place. And and this is actually one of the areas we are currently grappling with about enforceability when we just move to physical distancing, and the ability, therefore, for the authorities to deal with those people who decide that they want to ignore those requirements. But that is a focus of discussions, actually, over the next few days. Anything else which to add, Richard?
Yes, I think I'd just say that it's been a wonderful weekend weather-wise, hasn't it? And people have wanted to get out, and people can, and we'd want them to visit parks and our coastal areas. So some of these areas may look crowded, but we want people to have time outdoors. The important thing is that they should keep 2 meters apart from each other. And I don't specifically know what might have happened down at St Wands Bay or other areas yet, but looking at BBC News, I think last night, they reported on Lulworth Cove in Dorset, and on the beach there were lots of people, but it was noted that they were separated by at least 2 meters, and that's what we can ask people to do, because that is what is required of them. So we've got to find ways of interacting together while still keeping that distance, ways that our social life will involve maintaining that distance in this new normal. I acknowledge there have been occasions when people have been reckless, as Tom has said, and gathered together too closely and seemed to disregard the rules. The police have been wonderful in encouraging people to observe the rules, but let's face it, enforcement is difficult. We are all social people, social beings. We like to get together. But it's under continual monitoring. The police have been doing a great job and supported the strategy. And we must remember these are a minority of people. And by far the majority do observe and do understand why they need to observe the guidelines.
Susan, just a comment. I would just appeal to anybody who's feeling like flouting the guidelines. And it's not just about the risk they might be taking for themselves if they've decided they don't care if they get infected. They're actually sort of potentially damaging the progress that the whole community is pulled together to achieve. And it's a pretty sort of irresponsible thing to do for your own pleasure and freedom to put at risk what everybody else has worked hard to achieve.
Okay, second question, Tom.
Thank you. I'm surprised to hear that what seemed like a fairly major incident, it's one of the largest social media responses that I've seen over a weekend, hadn't registered and that hadn't been fed back to senior ministers. Is there in looking at what these people have done, is there a danger that we're preaching to the converted at these briefings, that the people who tune in are interested, educated, are engaging with the communication, and that there's a hard to reach group there who are the ones who perhaps are most at risk of ignoring these? What's being done to get the message out to there? I got a message today, a text message about this press conference, but that was my first text message for a week. I didn't get anything over the weekend saying don't go out and break glass and congregate in large groups of 20 or 30 people at La Frégate.
Okay, well, in terms of the texting messages, I think, took a view to just lower the volume of them, because again, it's around, if you look at where we are on the results, it is about, if you do it too often, people start to ignore matters. In terms of the audience that we deal with, this is always one of the difficulties in an island-wide communication strategy. So you've got some people, obviously, in the island who don't deal with social media and Facebook, and potentially aren't watching. They might be listening, if they're listening to the radio, obviously, to this particular briefing. But then equally, potentially some of the areas you're dealing with might hopefully be looking more at social media, not necessarily watching a live Facebook streaming now, but some of the other social media ways of dealing with things. And so the strategy has been to deal in as many varied ways across the whole communications options, shall we say. And I think from memory, we've got something like 28 to 30,000 separate Facebook accounts that certainly on one of the ones in the past, I think dipped into and out of this particular briefing. We're obviously doing we've done another household drop, so that's to all households in the island. We're also doing things across different languages, and certainly there've been different language, i.e. non-English adverts, for example, on Harry's employers on Channel 103. So we think we're trying to get it all the way across. I think what we also do take, in terms of when we're planning for things, we do allow an element of time for people to settle down. People coming out, it's a nice weekend, we'll have that kind of, not quite wild fling, but one of a better expression, and then hopefully they'll settle down to the next level of activity properly. And that takes us back to the enforcement. So there is enforcement behind the measures to date. There is the possibility, there is the ability to be arrested if people do not obey advice. And therefore that is around, as we identify areas about the police or the honorary police or whoever going along and giving words of advice. If people choose not to listen to those words of advice, then there can be consequences. And that then goes into the debate we're presently happening about how legislation needs to change, how you balance off the human rights and the civic liberties of people, and how we move more towards physical distancing and what enforcement can be around that. And that's a present discussion that is quite literally current and ongoing. Susan, do you want anything to add? Okay, right, Harry.
Good afternoon, everybody. I'd just like to get some clarity on testing, really, because I feel like it's all still a bit vague. I want some real clarity on what's been done till now and what the future plans are. Essential workers, exactly how many have been tested so far in terms of a number and a percentage of essential workers? And on that, we've been told of many targets. We've received so many media releases talking about wanting to double the number of PCR tests by the 11th of May, 500 tests a day. And from what I've seen, they haven't been hit. And now we get a media release last Friday talking about ramping up testing again with no real figures or any real clarity on that. And then we hear in a Chamber of Commerce meeting that apparently it's 8,500 over 3 weeks. And based on the fact that I don't think we've seen that the previous targets have been hit, how can we believe that you're going to do that now? It all just seems a bit like you're talking about ramping up tests and doing this and that when you're not actually achieving any of the targets you're setting.
I think there's an expression that somebody, and if it wasn't one of your media colleagues or I've read somewhere or a politician has said to me, it's about if you aim for the stars, you'll get to the moon. So the point is that the whole objective on this is to improve the testing, okay, which we've been doing. I'd hope everybody could agree, as a matter of fact, that the whole testing regime has got a lot more capacity to it, and that we're aiming to increase that capacity further. And so what we then split it down to, and I'll give warning to either Richard and Susan if whoever wants to expand on this afterwards, is what we need to focus on as well is the split between the tests, what we call the PCR tests, that are basically say if you've got it, and the antibody testing, which is basically saying whether you've had it. And the PCR ones are important because that's about if somebody's got symptoms, do they actually have COVID or not? That determines potentially whether they have to self-isolate for the period of time and all those type of stuff. And that is where we have been increasing the capacity. In fact, I think the results that came out on either Friday or Saturday suggested that we'd had 300 we'd achieved. It will depend on the number of tests that are carried out, if that makes sense. But you compare that to a couple of weeks ago, you should therefore see an increase in the volume of that testing. The objective, as I said, is to get to 500 a day. The practical issue is getting two pieces of computer kit to talk to each other across the water. And so it's being worked on. That capacity is improving. Whether we get to 500 today, tomorrow, or Friday, in the present situation is not a failure. We should be looking at the positive that we are increasing the testing from where we were back in March and have achieved those increases. In terms of the antibody testing, again, we took decisions back in, I'm going to say March, a long time ago anyway, which was to get the antibody testing kits. And one was an order for originally a pre-order of 50,000 of 150,000, and the other one was the one that, as I've said previously, Tom's colleagues put a connection in with us for another 50,000. That second group of 50,000 arrived 2 to 3 weeks ago, I think it was, and obviously it might have been slightly more than that now, and was evaluated internally, and we did the pilot study, whatever it was, 2 to 3 weekends ago. The second, that means now, having learnt from that pilot study, we are now able, as we put out on Friday, to say we are testing and ramping up that testing to the next level of trying to do a big test. And you're right in terms of the numbers. Richard referred to many thousands. The number I've been given is between 8 and 10,000. Now, I can't tell you precisely that's going to be 8,223 because until we actually know that's the objective, that's the target. But the principle is that we test many thousands of islanders. But there will always be individual hiccups on the way. Some people may suddenly decide they don't want to be tested for whatever reason. We had some of those. We had the issue previously, which actually was an ethics committee issue about whether you can test 16-year-olds, children up to the age of 16. That came in at the very last minute, so obviously that causes you a bit of a difficulty. I think that's something that's going to be raised during the course of this week. I'm looking at Susan on that front. But and so you will get always wrinkles on the course that you're trying to follow, but the objective we are getting to, and we are, there's not that many places where we can be talking about testing, if you like, 1/10 of the population of the jurisdiction within the next 2 to 3 weeks. But I hope that it gives you some clarity as to where we are. If you want to I'm sure we can find out the percentages of essential workers and things like that have been tested. Obviously, I don't have that information to hand with me today. I don't know if anybody else has got those details. Richard, do you want to add anything else? Or?
I'd just like to say to Harry that I think you can be assured that these tests will be carried out because we've got significant supplies of test kits in the island. We've opened up new testing stations. We've got more people in the teams to go out and do the testing. And we've got significantly more people in the tracing teams. So all that is ready. It's working. It's happening now. And you'll see it developing over the next weeks and months.
And just to add, we've also got a further type of testing, same thing around antibodies, which will fit into a piece of kit that already exists in the pathology lab. And that, again, we are expecting to receive again in the next couple of weeks, which will then give us much greater accuracy of testing. But that we've got to make sure it all works. We're trying not to overpromise and underdeliver. We'd like to do it the other way around. So until we've actually know that's in place and working properly, we're not relying on it. We're using the kits that we've took decisions a number of weeks ago to get on island, and now we're deploying them. Susan?
Just to avoid any confusion, I think what you've just been referring to is antibody tests, so serology. So there's nothing wrong with the accuracy of the PCR tests for people who've potentially got active infection now.
Yep.
But this is an extra string to the bow that might make it possible that we can greatly widen out antibody testing, which won't tell people that they're immune, but will be informative about whether they've had exposure to infection already.
Okay. Second question, I think, Harry.
Yeah, so just before that, just if I can get the details when you have it on the number of essential workers, that would be appreciated. My second question is, time is ticking quite quickly. We heard last week Guernsey's plan for bringing schools back, primaries from the 8th of June. I assume there'll obviously be an announcement soon on this, but talk is ongoing. Lots of teachers that we've spoken to and unions worried about that return to school and want to know the real situation with teachers and making sure they're safe and children are safe. We heard in the second phase that teachers will be among those that will receive these tests. When they do go back to school, is there a plan that teachers will be tested regularly? And if there's a situation where if a teacher tests positive, what does that mean for classes and what does that mean for schools in general? Do they all have to go home?
Richard, do you want to?
Well, what I can say is that the plan that these critical and essential workers to the island will be tested regularly. so that we can ensure that they are still able to carry on their work. So teachers will be. And yes, they will need, if they are tested positive, they obviously can't continue in work. I believe the tests would then move on to examine what contacts they've had, which might well include the class. So we would be ready to keep islanders safe and to carry out the testing regime, because we have the tests, we have the teams, we have the equipment, and we can do it.
Thank you. STAC this morning had a detailed discussion about the issue around children going back to school, and just to say that, not to preempt political decisions, but we were all firmly of the opinion that it would be overall in children's best interest to be back at school for many, many different reasons. And in terms of risk to children, it's the risk of significant illness, and certainly not serious illness, is incredibly low in children. So we've heard that some children were fearful of going back to school. There's no reason at all for that. There's also no evidence that children are any more infectious than adults, so there's no reason to think that they're super spreaders, a term that's been used in the past, because that is the case with influenza viruses. So it's not, all of the evidence so far, there's a huge amount of evidence from around the world that children don't pose a particular risk. So in terms of the social inequalities and the sort of falling backwards in education of children in the more disadvantaged situations, the fact that children need routine and structure and they're missing out on education, their world's been changed, but thankfully not for a huge amount of time so far. So for many different reasons, STAC as a group of predominantly medics, but many other very wise people are all on the same page that the risk to children is minimal. What we need to keep an eye on is the potential risk to the wider community. And it would be apparent, at least by the summer holidays, if, say for instance, the children did go back, a few weeks of seeing how that panned out in terms of the effect on the wider community, we wouldn't expect to see any particular increase in infection in children, because children don't tend to become ill with COVID. But there would be the opportunity to then shape what the situation was, and whether phasing was needed or what particular precautions were needed at the September return to school. But I think there was a strong support to advise our political colleagues that to find a pragmatic way that made all of the people in the school safe by having reasonable measures that allowed the children to get back to school.
Okay, I'm acutely aware of time here, so let's try and see. It depends if you can ask us short questions and whether we can give you short answers. But so one question each before we wrap up. So Freddie.
Thank you, Chief Minister. Just a quick question about tracing. We've talked about testing, but on the 30th of April, there was a press release that said the tracing team will increase to 55 people by the 11th of May. So obviously that was a week ago. How many people are now working in the tracing team? And can you explain what they do, their processes, in as much detail as possible?
I did ask for a short question that we could do a short answer to. In terms of the tracing team, as far as I am aware, we are either at the 55, okay, or yes. Sorry, Richard's confirmed we were at the 55, so we have achieved the objective. And the way they are trained in how to go through the tracing process. So there is a process to it. It was explained to me when I actually visited the call centre, but it's not something I can do in about 10 seconds. But there is quite a thorough testing process, a tracing process they go through, and the team has been significantly expanded. I think we're also aiming to expand it further.
Yes, that's correct.
Right.
So we want to add in several dozen to that team.
Okay. Elodie.
During this press conference, the new statistics have just come in showing there are now 303 confirmed cases, which is a rise of 6 cases over the weekend. Are we now seeing the results of the first relaxation of measures? And have you made any assessments as to how big the jump will be in 2 weeks' time after the rule breaking this weekend?
Right. I don't know if Susan wants to talk to this. What I can say is that it's going back to that point. We increased the number of tests we've done. Therefore, we were expecting an increase in the positive results because we're testing more people. What I've also understood is that, without going into the exact details, there were some particular cases which were retested and had previously not been shown as a positive, but were now a positive. So it wasn't a new person; it was just a different case that was just being redone. I don't know if Susan, you want to?
Just a very quick comment. One of the scaling up of testing in the last week or two has been expanding the criteria that make people eligible for a test. So until then, it was you had to have a fever and a persistent cough. But now the criteria are more general about general illness, which may include fever and cough, but it may include other potential symptoms too. So that in itself has led to more testing being done. But my understanding about the latest positives is that they're all connected to institutional settings. None of them are connected with transmission in the community. So we're talking about hospital cases, I think one or possibly two care homes, but all of those are contained situations which were already known of. So it was follow-up of existing situations with a wider testing protocol. So it's all more or less what you would expect. It could be higher, without causing alarm bells. There's no reason to think really that it's likely to have been the relaxation in the last couple of weeks, because those have been about increasing outdoor activity, and there's increasing evidence that the possibility of transmission occurring outdoors is incredibly low. You literally have to be within 2 meters of somebody and have a sneeze or a cough actually land on you. So it's a very, very low chance that the outdoor measures are going to make any difference to the community transmission of the virus.
Richard?
I think I'd just like to reiterate what Susan said. So my understanding of the 5 positive cases a couple of days ago are that they don't indicate a spread in the community. They are workers in the healthcare system, and that's good because they might have been working without symptoms. Our enhanced testing means that we can now test everybody. So if they are without symptoms, we know they have the virus, we will take them out of work. They'll be asked to self-isolate until that is clear. That is keeping people safe.
Okay, Gary.
You'll be pleased to know it's just a one-word yes/no answer to this one. Dr. Turnbull, we've never seen the science and advice from Jersey's experts during this pandemic. We don't get to see what you and your colleagues are presenting to STAC, which is then filtered before it gets to ministers. From messages I'm getting, there's a real appetite to know what you're actually advising, rather than it being run through the filter of politicians who have form when it comes to withholding or misrepresenting. Would you have any objection to following the UK and other jurisdictions and having your raw advice made public?
Gary, thank you for that question, but I can only reassure you and everybody else that I haven't seen any evidence at all of our politicians being anything other than extremely receptive to medical advice. And the STAC advice, there's already been a discussion, I think, by the scrutiny panel about sharing STAC advice with the panel for the same reason that they, wish, like you, to check that the advice is being heard at least, even though STAC only advises, doesn't decide, it's politicians decide. But I'm very, very happy and comfortable with the system that we're working in at the moment. And also outside STAC, if I had any serious concerns, I would take them straight to the Chief Minister and the Health Minister. And at the moment, I'm so pleased, having come back after a period of sickness absence, to find how incredibly well organised everything has been, and how many people, not just in the whole community, but within the sort of the repurposing of the whole policy department in government to aspects of COVID policy. And it's been a superb team effort. And people are communicating, and I don't think there's any reason to worry that there's any sort of skullduggery or cover-up going on, because there isn't.
Thank you. I hope that answers your the adjectives that we're using, Gary. I'll move on to Tom.
Yes, thank you. The first impression of Deputy Pershard's proposition when it came in last week, it seemed to be something of a wrecking ball to our safe exit strategy that had been lined out by ministers. But in the space of a few days, have you come to embrace and welcome that, and the chance to get it out in the open at the earliest opportunity in the Assembly tomorrow. And your reaction after a few days' reflection is right. Bring this on.
I think we're very happy to have the debate. I will say I'd actually offered the suggestion of having what we call an in-committee debate, which perhaps we could have done on Thursday, which allows politicians to actually speak more than once. And it means then as issues arise and people want to have that kind of backwards and forwards cut and thrust, as it were, or, we can then feed in other information. Whereas the slight problem with the debate that's going to be happening tomorrow, it's a very structured process, believe it or not. So other than the proposers, so when I bring the amendment that we're bringing, I'll be able to speak once at the beginning and once at the end. Everybody else in that particular round of the debate on the amendment can only speak once. And so that makes it slightly harder in terms of if we're trying to use the debate as an informative process. I don't know, Tom, I don't know yet if it's public. Obviously, as I said, we are bringing an amendment. I hope the report to that is deemed to be helpful. And as I said, we're not a million miles away apart, so I think we all welcome the debate. But as I said, if you look at the conclusion in Deputy Pershard's report, which, as I said, talks about a short period of intense lockdown, that particularly causes for us a concern. And also, Dr. Turnbull has alluded to already the terminology in terms of what people might understand by the use of the word elimination. So let's see where that debate takes us. We've had both myself, Richard as Minister for Health, and Lyndon Farnham as Minister for Economic Development we've all had very constructive conversations with Deputy Pershard, which I think she's welcomed, and hopefully we'll just see how that debate goes tomorrow.
Thank you.
Harry.
Thank you. The UK have just added loss of smell or taste to symptoms for the recommending people self-isolate with. Do you just clarify the position with Jersey on that?
My understanding is yes, we include that too.
Okay. Right. On that note, I'll just do a quick summing up and then we'll draw this to the end. So thank you to all the people in the media for your questions. I want to close really by saying that as a community, we should be really proud of the position we're in and the way we've handled the impact of the virus. Compared to the restrictive measures we've seen in other jurisdictions, we did not need to impose a complete lockdown. By taking the measured steps combined with the support and cooperation of islanders, we have successfully suppressed the growth and spread of COVID-19 in Jersey. Together, we've reduced the R rate to below 1 and our new weekly cases to almost 0, what we're now calling near 0. So together, we have bought the time, which is what we've always been talking about, needed by health and community services to prepare the infrastructure, the equipment, the testing and tracing schemes they need, and the personnel and all these other resources. And so together, we can ease out of the current lockdown. That requires time, and it requires careful, thoughtful measures that the Health Minister has set out. And it also requires you, as islanders, your continued cooperation. So thank you all for everything for that you've all done. And thank you for continuing to do so in terms of protecting our island and our community. And on that note, I'll bring this press conference to an end. Thank you very much for listening.